Cancer is just something that we all have to recognize, acknowledge, cope with, live with, struggle with, rage upon, crush, and even thrive with. This show is more than knowing and fighting or beating cancer. It's more than just relaying science, hope, and technology. Together, our purpose is to demystify cancer, take away as much fear out of the diagnosis, treatment, and process as we can, defeat its grip on our lives. This is The Cancering Show. Welcome back to The Cancering Show. I'm excited to come to you today from the studio to talk about a topic that's come up in my practice several times. And I just think that I need to have maybe a public service announcement or a spoiler alert for those of you just starting out in your cancering journey. I hate to give you this spoiler, and if you want to wait till you're at the end of your cancering journey to listen to this and you know the ending, then that's just fine. But here it comes, folks. Cancer is a chronic disease. Hate to be the one to tell you. And that is why, in case you're wondering, why do we call it cancering? We call it cancering because it is an ongoing activity, unfortunately, for most of our cancer patients. And, I don't even like that I used the word unfortunately. Having a cancer diagnosis, going through the process of cancer treatment, and being in cancer survivorship can actually be an incredibly empowering, cathartic, and life-altering, in a good way, experience for patients. So I don't want you to think of it as unfortunately. But I do want you to think about what it means to be cancering, and is there an end? So we're going to talk about cancering today and what it really means. I have to say, while there may be a beginning and there may be a middle, it's hard to see for a lot of patients where that ends. There are some patients who come into our office, have a great checkup or follow-up at that 5-year mark, for some patients even the 10-year mark, and then we say, you know what, you're definitely cured of this disease. But let me give you some statistics. There are 2 million new cancer cases out there in the United States every year, but there are 18 million people who are living as cancer survivors every year. That's 5% of the population of the United States. And in the next 10 years, as we have more and more people living with cancer, living on maintenance cancer medications, that number is going to go up to 22.5 million. That's another 25% increase in the people who are living as cancer survivors. So when we talk about cancering, we talk about cancering as a marathon, not a sprint. And it is hard to see the finish line for most patients. I want to tell you a little story. This topic came to me because a patient looked at me with wide-eyed surprise when I suggested that she come back for follow-up after a diagnosis of a stage 1 cancer, and that I was even considering making a recommendation to her of a long-term maintenance medication. And these recommendations for follow-up are not unusual at all, even for earliest stage disease. And she really thought that cancer was, quote, one and done, that she came in, she got maybe a surgery, maybe a treatment, and then she was done. And that was the end of her cancer journey or cancer diagnosis. And I will tell you that's not the norm. And even for skin cancers, you are recommended to have long-term follow-up to prevent another diagnosis. So we're going to talk about what it means to have cancer as a chronic disease, what it means to have cancer as a lifestyle disease. What about long-term treatments like maintenance therapies? What are those? And how do we get back to a normal or a new normal if this never ends? So when is cancer a chronic disease? Here's the spoiler alert. All cancers are a chronic disease. What do I mean by that? What is a chronic disease? Well, I think as a physician, I think of a chronic disease as something that is always listed on your past medical history, kind of always affects my decisions regarding future treatments or medications. We might have to do extra testing before making a decision on a treatment because of this history of another disease that may have a lasting impact on future medical decisions. So all cancers in that category count as a chronic disease, whether or not you still have them. But I want to point out to you that that doesn't mean that most patients are living with cancer. 80% of cancers these days are considered curable or at least have a 10-year survival or more. That's most. So let's think about what that means. Some cancers, as a chronic disease, might actually carry a lifetime of treatment. And it is important to ask your doctors as you're cancering, am I expected to be on medication long term for this diagnosis? And can help with really getting your mind around what this looks like in your future. And we can't talk about cancer as a chronic disease without talking about the fact that there are some cancers that are considered incurable, but that doesn't mean that they are killing you today or this week or this month or this year or in the next 5 years or possibly in the next 10 years. Cancer can be an incurable chronic disease in the same way that diabetes and hypertension can be diseases that people live with long term and live out their normal life expectancy. So these are all questions that are important to ask when you're trying to frame how much of your time and energy you're going to put into this cancer fight right now and in the long term. And of course, we would encourage you to think of every cancer diagnosis as a marathon, especially as regards our next topic. When is cancer a lifestyle disease? So by a lifestyle disease, I mean that a doctor is going to make a recommendation to you to get more sleep or reduce your stress or stop smoking, change your eating habits, or add more exercise to your daily routine as part of the management of your disease. And spoiler alert, all cancers are lifestyle diseases. So first, of course, we can't not mention that there are cancers directly related to smoking and that quitting smoking for all cancers does improve the likelihood that your cancer treatments will work better and that you will be more likely to survive your cancer long term. So we absolutely recommend to quit smoking, and we have lots of options to help you with that, and most cancer centers can directly provide support, counseling, and coaching. So definitely ask your cancer provider about how to help you stop smoking, whether that's at the beginning of the treatment, the end of the treatment, or even as you are being told you're cured and walking out the door permanently. Any time is a great time to stop smoking. Next, let's talk about the obesity-related cancers. There are 14 obesity-related cancers, including all of those that are caused by a type of hormone imbalance like breast, prostate, and endometrial cancers. Colon cancer can be related to obesity and many other common cancers. And we know that changing eating habits and losing weight doesn't have to be much as 10% weight loss can make a huge impact on your risk of recurrence. All of these things can decrease the chance of the cancer coming back and increase the chance that your medications are going to work and control your disease. All cancers are made better by increasing your exercise or mobility. Every single one of them improves your longevity, both for cancer and long term. So we always recommend getting back to some type of movement. We always say move with joy rather than think about exercise, but what's something that's really fun for you, whether that's dancing in the kitchen with your kids, which you've heard me say before is my favorite form of exercise, or if it's out walking the dog. Any type of movement that brings joy to your life and lowers your stress is a great option. What about long-term cancer treatments? Many cancers are now recommended to have some form of long-term treatment. Now, the most common one that people think about is a long-term hormone blocker like tamoxifen for breast cancer or other hormone blockers for prostate cancer. But there are lots of cancers out there that are recommended to have long-term treatments. These treatments these days come in both oral and IV form. Just because it's oral doesn't mean it's chemo, and just because it's IV doesn't mean that it is chemo treatment. There are IV maintenance therapies that can be targeted therapies like bevacizumab or immunotherapies like the one that our dear friend Helen Bender was on in episode 33, Feeling So Alive with Helen Bender. And each of these comes with its own benefits and risks, and it's important to ask your doctor. First, we recommend that you ask your doctor at your first appointment, are you going to recommend a maintenance chemotherapy, immunotherapy, or targeted therapy for my cancer treatment? And at the end of a chemo regimen that you've been told is a limited time for 6 months, you want to ask again, is there any recommended maintenance medication for me? I will tell you that for stage 1 and stage 2, the recommendations for maintenance medications are limited. But for advanced disease, there's more and more indications for a maintenance medications for a year, 2, up to 5 years. And for breast cancer these days, there are indications for up to 10 years of treatment. So it is really important for you to have that information right up front or right as you finish your more intense what we call induction chemotherapy that really gets to the killing of the cancer and into maintenance, and really have that in your mind that you might be looking at a long-term treatment. It's also really important to review the risks and benefits of those long-term treatments because they aren't without risk, but can have long life benefits. And so some of those risks are worth taking, and you really want to discuss that with your doctor before making kind of a snap decision in the office to say, oh, I definitely don't want to do anything after this. I just want to, quote, feel normal again. And for those patients who do choose long-term maintenance medications, there might be benefits that wear off after a year or two and that, really might lead to an increased risk. So in every indication, we definitely recommend an ongoing communication with your oncologist to talk about the risks and benefits to you and your individual cancer. Last but not least, can you ever get back to normal? The first thing I would say is, what is normal? For a lot of our cancer patients coming into the office with a new diagnosis, they didn't feel great. They had maybe symptoms related to their cancer or fatigue from changes in their body related to cancer or chronic inflammation that they hadn't felt well for a while. And if the question is, can you feel better in the post-cancer, post-chemo phase of life? The answer is absolutely yes. I think people can feel better mentally and physically than they have in a long time. But there are chronic changes related to cancer treatment, and chemotherapy that we want to address. First, we always hear about things like neuropathy or numbness in the fingers and toes. Sometimes there can be hearing or vision changes that require changes in prescriptions, even hearing aids for older patients who already had trouble with hearing loss after a cancer diagnosis and appropriate cancer treatment. But these are uncommon and usually related to folks who have had trouble in those areas before, maybe a new eyeglass prescription, no big changes. The one that patients talk about the most is what we have heard patients describe as chemo brain. Now, we know that there can be acute neurologic changes related to particularly cytotoxic chemotherapy. These changes are really minimal with things like hormonal therapy, immunotherapy, and even some targeted therapies. So really what we're talking about are the traditional chemotherapy medications can have neurologic changes like trouble with memory, attention, and concentration, sometimes even trouble with sleep. I want to table this discussion a little bit because I want to come back to you with a neurologic specialist where we can talk at length about the neurologic changes associated with chemotherapy and how to manage these side effects long term. But the short version, what I will tell you is many of these changes improve over 3 to 6 months. In particular, fatigue and really feeling like their endurance is back can take up to a year. To note that the feeling of being totally back mentally and physically and really ready to tackle any new challenge, and that whether those are physical changes or emotional changes or mental changes can take up to a year. Now, for the most part, we tell cancer patients to anticipate that to be a new normal. Like many of the things that we've said above, a new normal that may include a treatment or talking to doctors about your diagnosis or having regular follow-up appointments. I will tell you this was true for me after I came back to work after having a child. It is true for many of our patients who have a new diagnosis, whether that is diabetes or MS or another chronic disease. There's so much more we could say about cancering and cancer survivorship and cancer as a chronic disease. And I wanted to make sure that you left this conversation looking at the long game for cancer and making sure that you think about this at the beginning and the middle instead of just looking for the end, but really thinking about cancer as a marathon and gearing yourself up for those changes that might be recommended, whether that's lifestyle changes, chronic medication, or chronic changes. We know that this could lead to changes that you have to live with, but also it can lead to seeing color a little bit brighter, feeling joy a little more sharply, laughing harder, hugging longer, and really living the new normal that is the best life you could hope for. As always, thanks for listening. Can't wait to talk to you next time. Until then, take care of yourself and keep cancering. Thanks again for listening. And don't forget to submit your questions at www.cancering.com. We're here for all of those questions and we'll get you the answers. This show is brought to you by the University of South Alabama Mitchell Cancer Institute. MCI is a cutting-edge cancer research and patient center built to fight cancer smarter in Mobile and Baldwin County, Alabama. Our researchers and clinicians focus daily on the struggle against cancer, serving a potential catchment population of more than 4.1 million people, with a singular focus of advancing cancer diagnosis, treatment, and prevention throughout the Gulf Coast and beyond with science, technology, and hope. Want to know more about the Mitchell Cancer Institute? Visit us at usamci.com or search for us on Facebook, Twitter, and Instagram. Mitchell Cancer Institute is a member of USA Health. To learn more about all of our hospitals, clinics, and services, visit usahealthsystem.com.